Hi, my name is Maya and I'm a nursing student here at MSJ, and today I'll be assisting my patient in trach care. So before we begin, we just want to make sure we get all of our trach care set. So we got our trach care set as well as hydrogen peroxide and saline, okay? Also before we begin, make sure we identify first and last name and date of birth. We're also going to explain the procedure to our patient and receive consent. And then finally, which is most importantly, is make sure we're doing a respiratory assessment on them before beginning. So after I finish with all of that, I can begin my procedure. So I'm going to do hand hygiene. Make sure you have everything all set before becoming sterile. So especially like opening these before getting all set and ready. All right, so next I'll start opening my trach care set. All right, we're just gonna move it over a little bit to the side. Make sure you can touch the edges of it, just don't wanna touch the inside with it, okay? And then we are gonna grab our gloves. Make sure you're only touching the edges of it, okay? All right, next we're gonna start doing the gloves now. Since I didn't put this glove on properly, we don't wanna start fixing it until my other glove is on. So now I can adjust it and everything. All right, now I have all my sterile gloves on. So we just kind of grab this from the inside and then throw it to the trash, trying to. Okay, so then next we are gonna do our drape. So I'm going to touch the inside of this only because that is sterile, and just move it a little bit away, okay? And then I'm gonna grab the drape, make sure we hold it up high so we're not touching anything. And we're gonna put this blue side down. Okay, just like that. Next, what we're gonna do is that we're gonna take all of our things out. Make sure we just keep it in the middle, not around the edges. Perfect, just like that. And then finally, we're gonna break sterile with my non-dominant hand and just pouring the saline. Okay. All right, now since that all is set, we can begin our trach care. So with our patient, they'll typically have oxygen over their trach. However, you don't see an oxygen, so we're just gonna mimic it. So we're just gonna take the oxygen off of it, and then we are just going to twist the trach out. And then we're just gonna gently sit it in our big thing. And then yeah, so then what we'll do next is that we're gonna let it, and put the oxygen back over. That is most important, don't forget about that. So then next what we're gonna do is that we're gonna grab the trach by its end, and then we are going to use this brush. So make sure we want to keep sterile and non-sterile away. We're just gonna brush the outside of it. Make sure we're gonna dip it in some of our saline and hydrogen peroxide. Perfect. And then we're just gonna toss it out. And then this, we're just gonna kind of get in the middle of it. So make sure we just don't touch it. Perfect. And then we're just gonna toss that out as well. And then finally, we can just place this back in our last container right here. And then biggest thing, we're just gonna wait until it dries a little bit. Now that we gave it a period of time, I'm gonna grab it with still my non-dominant hand. And then I'm gonna take the mask off and then gently put it back on. There we go. And then we're gonna place the oxygen back on, okay guys? So now sterile procedure is over and finished. So finally we can touch anything. So now what I'm gonna do is I'm just gonna grab a Q-tip. I'm gonna dip it in this first corner one, and then I'm just gonna clean under our, under the trach. All right, I'm just gonna drop that. And then same thing, dip, dip, dip. We're just gonna clean up and around. All right, drop that. Finally, what we're gonna do, so typically we have our little dressing and we have extra gauze. If there was any more secretions, I would just use the extra gauze just to clean up. But since I don't see them, we won't really need to use the gauze now. Finally, what we'll do is that we will put our new dressing on. So with the slit, it's gonna go in between the trach, okay? So make sure, biggest thing we're putting this on is that we're just pulling it super, super gently, because the trach, there's nothing holding it besides this trach collar around our patient. So we just gotta be really careful so we don't pull it out, okay? Make sure the biggest thing is that the slit is around there. There we go, and that looks pretty good. Finally, I'm just gonna discard my gloves, and then hand hygiene. I would get a new set of gloves for this last thing, is that I would just make sure to fit 2 fingers under the trach collar to make sure that it's snug, but it's not too tight. Then I would clean up my station when I'm done, and then finally, I would go document. So what I would document is that the procedure went successfully with 0 complications. We did leave the oxygen mask back on once the patient was finished. As well, we are gonna do a quick assessment. We did a respiratory assessment before and after the procedure, and no complications with that. And patient has remained in the room safely, comfortably, and yeah, and everything like that.